So navigators have different several challenges in Guatemala. One of them is, for example, because they are volunteers, they don't have any kind of financial support. Second, they don't have a specific space inside of the hospital to discuss some information with patients in a privacy area. Third, they had to spend most of their time suing this institution. So they are actually, the navigation in Guatemala, it is not like we see navigation in the U.S. In the U.S., we are facing perhaps transportation, health insurance, childcare, and perhaps, of course, distress. And we have more practical challenges here in the U.S. versus Guatemala, where right now patients are actually dying. So our navigators have to learn, first of all, how to sue this institution, how to write the information, like legal information. I understand that they have some legal support also from different organizations. And they are not the only one who are suing this institution. There is many other organizations that has to raise right now and to help people. And of course, this institution is working with the government because these institutions are getting funding from the government, $3 million of US dollars every year to support patients and provide free treatment. But still, for some reason, they are not able to provide that as needed and on time. So the challenges that our navigators are facing, and it's not just our navigators and patients, is the time to sue this institution. A lot of indigenous patients prefer to go back to their village instead of suing this institution, staying in the city for perhaps 3 or 6 months waiting for a resolution. They cannot afford to be in the city. Transportation in Guatemala, if you want to have treatment in the city, perhaps you have to travel 6 to 12 hours, depends where are you located. Plus, a short accommodation is really tough. Some people in Guatemala, especially in the rural area, they are making perhaps $3, $5 weekly or less than that. So now this institution is asking sometimes $600 or $1,000 for starting the treatment. So how can you ask that? So that's one of the challenges, as I mentioned before, is finances. They don't have a space, time investing in suing this organization, and also data collection. We don't really have a culture in Guatemala of data and collection and analysis. We are working right now, I understand, and I read a couple articles, that Guatemala is right now working with the World Health Organization to improve how we collect data and have more accurate information. So data collection is really tough for us. When I bring the first training to Guatemala, I was talking about data. And even though today, that was in 2016, today we still have some issues for them collecting data. So we had to reinforce that because it's important to have those numbers.
Our South African navigators have met some surprising challenges. One of them is suspicion. So from our doctors, and sometimes even from the patients, is, why are you giving us this service for free? What are you up to? What's this all about? And that was totally unexpected. We didn't realize that would happen. And that has been a positive reinforcement, and we've had to market ourselves a lot, again, to our stakeholders. Doctors are external to our hospitals. They are not part of our hospitals at all. So we've had to market our programs to our external stakeholders as well as our internal stakeholders, the people, the healthcare practitioners actually working in those hospitals, such as nurses, such as dietitians, such as pharmacists, etc. Sometimes we've come up against quite a territorial approach as well. These are our patients. What do you want to do with them? Why do you want to meet up with them? Why do you want to know who you can navigate? We weren't anticipating that either. There has been certain, again, how to learn to be a navigator. Where are your boundaries in terms of, am I going to be friends with these patients and their families, or do I have a professional approach? And where is that line? So we're learning. There's nothing that cannot be overcome. but it is a process of learning and sharing information, learning from others that have more experience than us, and trying to find the road that will work for us in our context, in our country.